Hello. Good morning, Dr. Pankaj.
Good morning, sir. Good morning, sir. How are you, sir?
Good. How are you?
Perfect, sir. Perfect.
Yeah.
Sorry, I missed yesterday's session. I was in other hall.
Okay. Yeah.
How are you doing, sir?
Good. Very good. Hi, Maya. Hi, Meredith. How are you?
Oh, good. How are you?
Good morning.
I don't get to see you in America, so I have to see you in India.
Exactly. For sure.
Maya, you look beautiful. How are you, my dear?
I'm good, thank you. Thank you for asking. How's your family?
Family is good. Family is good.
Good.
And how is Susan?
Susan is great. Yeah, she's wonderful.
Yeah, I'm very, very happy for her.
Thank you. I'll tell her you asked.
So we are waiting for just 2 more our panelists, and then we'll start.
So, Dr. Pankaj, Namrata may have told you, I may have to check out for a few minutes and then I'll come back. Yeah.
Not an issue, sir. Not an issue at all. So we are here for 2.5 hours. So definitely we can go in between.
Beautiful. I'll come and join back. Yeah.
Right. You can finish that and then we can come back, sir. Definitely. So the same link will work. The same link, you have to go through that same link and you'll enter that there.
No, I have opened another laptop, so I will just turn off the camera here and I'll go on the other computer.
Oh, okay. Perfect.
Yes.
That's good. Good afternoon, sir.
Good afternoon, Dr. Pankaj.
How are you, sir?
Good.
All set, sir?
Yeah.
Okay. Avinash? So Dr. Datta is he's joining. Mr. Deepak is also joining us, and Dr. Prakash, I think, sir, he's joining.
Yeah, he's joining. I just had a word with him a couple of hours ago.
Okay. So in the meantime, we'll start with this just the introduction part. I think Mr. Deepak is here. So Nandan, I'm starting. You can start admitting people. Okay.
Okay. Yes, sir. Yes, sir. Sure.
Yeah. Okay.
Yeah.
Great. So welcome to all the delegates, all our panelists and our speakers, the faculties, the members of the IPSC. So I welcome all of you for this wonderful session, a unique session on the business of pain medicine. When I introduced this in our conference, the business of pain medicine, people were a little reluctant to use this business word, and also they were also suggesting that we should not use business word in the clinical practice. So there was some hesitation in using this word. But I can see Mr. Vanu smiling. So I'm sure that in the delegates also people are also thinking about that, why we are using this word of business. I'm sure that after finishing this panel discussion of 2.5 hours, you will understand why it is important. Why it is important for the clinicians, for the physicians who are treating, for them to understand the business, for them to understand the market. So this is also a very important part. Entrepreneurship is a very important part. We all are good in our clinical practice and our services, whatever we are giving. But at the same time, we should be well versed with the business part of this healthcare industry also. So that is what the aim is of this panel discussion. I'll just quickly, before I introduce to all our panelists, the great panelists, I would like to take you all through this, just a basic about the pain management as an industry. So why we are talking about the pain medicine as a business, as an opportunity? Because we already have an experience. So whenever we discuss about the business opportunities with the non-medical people and with the financiers and the industry people, so I always take this example. What is the experience? We have this experience, like I always give this example of angioplasties in cardiac as versus to the cardiac surgeries. So what used to happen 2 decades back or 3 decades back, most of the patients with the cardiac blockage, they used to undergo a bypass surgeries, a big surgery. But now today we know that 90% of the cases of the heart blockage we can manage with the minimally invasive technique, that is called angioplasties and the balloonplasties. So that is the one example. So we already have this experience of minimally invasive techniques, a big experience with us. Also the technology, the second part is technology. Now we know that, again, I give the example, very small example, like if you have a spine fracture, what comes into your mind? If I have a spine fracture, what will happen to me? Everybody thinks that I'll have to undergo big surgery. But now we know that with the technology, we can go with just a small hole and we can fix. We can do many percutaneous procedures. And that is what we discussed in last 3 days also. We witnessed so many new interventions, so many new innovations in the field of the spine interventions, where we can do, with a minimally invasive technique, we can do a lot of things. So that is the technology, advancement in the technology. That is also we need to understand. The opportunity. Opportunity means we talk about the market size. This is a huge burden of the patient who are suffering from the chronic pain, especially the musculoskeletal pain, the spinal pain. So that's a basically big opportunity for all of us. And also the growth. And when we talk about the growth, the best to look is that the industry, what industry is doing the surveys, the markets research. So the device industry, what markets survey they do, that is one of the best survey what we have. And that is actually showing a growth rate of more than 8% for the spinal pain and for the chronic pain industry. So that is a very huge, good CAGR, that is called annual growth rate, which is, if you compare with the other device industry, for the surgical industries, it is around 5 to 6%. But for the chronic pain management devices, for the chronic pain management, it is showing more than 8% of the CAGR. So these are all the factors which shows that we have a good opportunity in front of us. So when we talk about the chronic pain, we are not only talking about the minimally interventions, we are also talking about the non-intervention procedures. We are also talking about the minimally invasive techniques. We talk about the less invasive techniques like vertebroplasties, like endoscopic discectomies. And also we are talking about the advanced interventions, like we have a spinal cord stimulator, snittothecal pumps, cordotomy. So all these procedures are included in the minimally invasive or the market of the pain management. So this is the flip side of the problem, is an opportunity. This is what we need to understand. We can see the chronic pain, we know that it's a big problem. But what we are seeing is that we are only seeing the tip of the iceberg. The problem lies over here. There is a huge problem of chronic pain in the community. And this is also the opportunity for the pain physician. So the more the big problem, the bigger is the opportunity. So that is why I mentioned that it is the flip side of a problem is an opportunity. So we have to dig inside, we have to go inside, and we have to search. It is there. It is there in the market. The market is already there. The market is already huge. Only thing is we have to see and go and see the size of this market. And that lies over here, not here. So why this problem? Now we know there are some good studies. A lot of studies are there. I'm not quoting all of them, but just to show some of them. The WHO has already recognized that chronic pain is going to be a fourth leading cause of disability by 2030. Fourth leading cause of disability. So that is going to add a huge number of patients with the chronic pain. We also did one survey with big study for 2 years. We did a study which was published in the Indian Journal of Pain, and that showed a very striking feature. And one of the feature is that the 25% of the patient accepted pain as a part of their lives. That is a huge number. 25% of the patient who are suffering from chronic pain. There's another study, a European study, which shows that which is around 19% of the patients, especially the patients in the younger age group, they had lost their jobs due to pain. So these are the various studies. You can see a lot of studies are showing the burden of this disease in the community. And what is adding, why we are having added number of chronic pain patients. The main reason what is multiplying the number of the patients with the chronic pain is these two reasons. One is the younger patient, the younger population. We know that nowadays the younger population is getting affected with this chronic pain, especially the back pains and neck pains. And mainly it is because of their sedentary lifestyles. The lifestyle what they are living is adding to the chronic pain patients. So this is a huge number. Earlier, if you see the studies, what they're showing in the younger age group, the average age is going down, which used to be like 35 plus. Now it is like 30 or late 20s or the early 30s. It has gone down to that level. So more number of younger population is getting affected with the chronic pain, and they are losing their jobs. That is one of the striking feature. And also, which is multiplying in the number of the chronic pain patients, is the increasing in the geriatric population. So this increase in geriatric population is basically mainly because of the increase in the life expectancy of the person. So that is another very striking the studies or the data which is coming out, is that in the US it is shown that the women over 55 years old population, the hospitalization burden of osteoporotic fracture, hospital cost is greater than that of MI, stroke, and a breast cancer. All combined, this is more than the whatever we have, what we consider as the major burden of the disease. But what we are not seeing is these osteoporotic fractures, the musculoskeletal disorders. We don't talk much about these problems, but they are basically making a big problem. They're adding to the chronic pain patients in the community. So these are the giants, the market giants. They have done a lot of research on the chronic pain management, and we are talking to these people, and we have been talking to all these market people, and they are very excited about the growth in the pain management device market. And among them, we know that about is there, the Avanos Medicals, the Boston's, J&J, Stryker. These are the Medtronics. So these are the major players in the industry who are showing a very good growth in the device market of the pain management. Avanos Medical is one of our sponsors here in this conference. So what is the global burden? So global burden, this is the global burden. Also, you can also say that this is our market also. I'm sorry to use this word but this is a panel discussion on the business of the pain medicine. So I'm using those kind of words which physicians usually don't like, but as a business perspective, we have to talk about these. So 10% of the world population is suffering from chronic pain. Around 30% of the people are in the age group of 18 to 49. That is a working age group. This is more striking. The working age group is 30% of the population. The working age group, they are suffering from the chronic pain. So you can also correlate it with the burden on the, not just burden on the patient's perspective, but also on the community. And 60 million in terms of the number of patients, 60 million of population is suffering from chronic pain. 70% of these respondents who are suffering from chronic pain, they say that they have never received any good treatment for the chronic pain. In India also, we have seen that a lot of respondents, they have said they have not even heard about the pain specialists who are there to treat their chronic pains. And another very important striking feature for us, as a pain physician, from when you see from the market size, the 79% of the people who are suffering from chronic pain, they visit GPs. They don't visit the pain physicians. They are not aware. Either they are not aware of the pain physicians, or they are not referred to the pain physicians. So this is a market size for us. So definitely when we talk about, since we are talking about the business of pain medicine, we talk about all those things, about the size of the market and all these terminologies. But at the same time, as a pain physician, we have a responsibility towards the community. And this is a wonderful phrase you can see here. The failure to treat pain is viewed worldwide as a poor medicine, unethical practice, and an aberration of a fundamental human right. So we have not only the business opportunities in front of us, but we also have opportunities to serve our community. So with that, I'll stop the introduction part, and I'll now would like to introduce all our panelists, the great eminent panelists who are there, who have joined us for this panel discussion. They are from the various different branches, from different specialties, but all of them are the top notch in the healthcare industry. So with that, I'll introduce to Dr. Sukhdev Datta. Dr. Datta, you're there?
Yes,
Okay.
I'm here.
So Dr. Datta is a graduate, medical graduate, and a specialist MS from India. And after that, he did his anesthesiology residency and a board certification in pain medicine from USA. Another important qualification which is added is that he is a master's in business administration, and that is why we can see that he is having a chain of the specialty centers in USA and in New York. So he is also the founder of the 21st Century Remedies. It's a private limited company, I think so. He is currently the founder and the director of the Datta Endoscopy Centers. They have around 5 centers in New York. So I welcome Dr. Datta.
So thank you for the nice introduction. I believe everything that you said is relevant also in the US.
Yeah. So our another panelist is Maya Raj. So Maya, I know her since I think 2010. We met in USA in 2010 in WIP conference, or maybe before that, also maybe 2008 in Budapest, Hungary. So Maya is a graduate in arts, and she has done some graduation in communications, films, and media. And she has been associated with WIP since I think the foundation of the WIP. And she was also the director of the development of WIP Foundation, which was founded in 2010. Currently, she is the director and educational content partner of the Paincast, which is in the Cincinnati. They are doing wonderful job. They have wonderful video collections and lecture collections with them. And I think anybody who's practicing pain, they must become a member of this Paincast society, which is doing a wonderful job in the education. Another very important introduction about Maya is that she is a daughter of father of the modern pain medicine. I would say that he's the father of the interventional pain medicine, Professor Prithvi Raj. So welcome, Maya. We are also very fortunate that we have with us Dr. Prakash. So Dr. Prakash, is he here, sir?
Yes, I'm here. Yeah, I'm here.
Good afternoon. We are very fortunate that you are here, sir.
Very good
So
afternoon.
we have with us Dr. Prakash. So Dr. Prakash is again a medical graduate from Tanjavur Medical College, and he has done his MS Medical Masters in Surgery from Madras Medical College, a very prestigious college in India. And he has done his FRCS from Glasgow University, and then he changed his line towards the management side, and he joined as a medical director in Star Health Insurance. That was in 2007. And from medical director, now he's become the managing director of this Star Health Insurance, which is one of the biggest health insurance, private health insurance company in India. So I welcome Dr. Prakash.
Thank you.
We have somebody from the industry of huge experience with the industry. Meredith George is there. She is a specialty coding professional in pain medicine. So she has a huge experience of pain medicine in coding systems. She joined one of the very important, very big company. Everybody, all the pain physicians know about this EpiMed company. She joined EpiMed company as a director of the reimbursement in 2003, and currently she is the director of the physician services at EpiMed International. So welcome, Meredith. And we have with us Dr. Sudhir Diwan. We all heard him yesterday. A very nice talk about on the regenerative medicine. He is a very good. He has a lot of books. He has authored a lot of books, and he is a co-author of some of the atlas of the pain medicine. And he's also the past president or the immediate past president of the American Society of Interventional Pain Physicians. The delegate. So, and currently he is the president of the Advocacy Point of on Park Avenue, New York. He is his own center in New York. So I welcome Dr. Sudhir Diwan. Welcome, sir.
Thank you very much, Dr. Pankaj.
Thank you, sir. We have with us Mr. Manivanan. He is a chartered accountant by profession, and he has a very unique combination of healthcare and finance management. So he has been into healthcare industry as a consultant into healthcare industry, into various pricing and costing projects with the multiple hospitals, multiple chains of the hospitals, and multiple big corporate hospitals. So, and also he is the professor, he's an additional professor of Indian School of Business, where it is actually where I met him in Indian School of Business. I'm a graduate from Indian School of Business. And he's also a consultant to a lot of government panels where he's deciding on the, he's one of the member of some of the panels where they are deciding on the costing and the pricing and the packages for the government panels. So I welcome Mr. Manivanan, sir.
Thank you, Dr. Pankaj.
We have somebody from the industry, Deepak. Deepak, are you there? Whoa, welcome.
Yes, Dr. Suranga.
So again, Deepak is from the engineering side. He's from the biomedical engineering side. He's from graduate from the IIT Madras, which is again a very prestigious institute in India, Indian Institute of Technology. And he has done his MBA and PhD from the Purdue University in USA. He's currently the president and the CEO of the Inspan LLC and the Sacris LLC in USA. So these are the two devices. He's from the device industry, and he's coming with a lot of innovations in the medium spine interventions. And these are the two techniques we also introduced in our AMP. Yesterday we had a nice lectures on the Inspan and the Sacris. So I welcome Mr. Deepak. Welcome, Deepak.
Thank you, Dr. Suranga. Appreciate it.
We have with us Dr. Urfan. Is he here? Dr. Urfan. He's a medical graduate from Kashmir, from India, anesthesiology from Texas University, and he is the CEO of the Spindletop Pain Management Holdings, and he's currently the founder and CEO of the Tri-City Pain Associate. Maybe he'll join us later. Okay, so with that introduction, I'll stop this presentation over here, and now we will move on to our panel discussion. Okay. So let me start with Maya first. So Maya, you have been associated with this specialty of pain medicines since the foundation of the WIP, and you have very closely seen your father, Professor Prithvi Raj, working in the pain medicine, how he has grown this field of pain medicine. So you're the best person, I think, who can tell us what changes we have seen in last 2 decades of pain medicine and where we stand now in terms of pain medicine.
I think one of the biggest changes in the past 2 decades has been technology. So now that there are wearables, implantables, things like that, there's less time going into each procedure. People are able to get in and out same day. Those types of things just didn't happen 20 years ago. So that's one of the biggest advances. And with that comes technology and learning as well. So you don't have to visit every conference. You don't have to travel if you're unable to get scholarships and things like that. That you can also complement your travel and experience with online learning. And so being able to be a student of the internet, of the world, of global education has really come a long way, and it's allowed pain physicians to collaborate in real time from all over the world, whatever country they're in, and to talk about cases and to manage their cases worldwide. So I think that's one of the biggest developments.
Yeah, so since Maya, you are also into the pain education programs, multiple education programs. So WIP, you have seen that WIP started this fellowship programs, the certification program in 2003, I suppose. So how do you see that where this pain education program is heading towards? Is this what we currently in last 1 decade, maybe we can see that there are a lot of institutes which have opened up in the pain medicine for the pain medicine teaching programs. So do you think that these institutes, they are coming, are they up to the standards, or we need to work on these standards of the pain education?
Yeah, I think it's very important that the pain education continues, and programs like FIPP and Pain School International and ISP training programs, things like that are very, very important, and they need to continue to be up to the standards. So I think that as long as they're following the protocol and always challenging themselves to be the best against each other and making sure that the pain physicians have that type of training. Currently, because there is not a residency in pain management, it's only a fellowship, it's more important than ever to expand that learning.
Yeah, so that is true. So here also in India, now we are coming with some fellowship programs, but let me tell you about the latest development in India. In India, we have the pain management as a super specialty now. So after your specialization in anesthesiology, people can go for the 3 years of residency program that is called DM in pain medicine. And that has come up with a very premium institute of India, that is All India Institute of Medical Sciences. So in India, it has become now, it has become a super specialty. Pain medicine has become a super specialty. We also have some fellowship programs, 1 year, 2 year fellowship programs in multiple government institutes and the private institutes. So that is one of the biggest changes what we have seen in last 3 to 4 years in India also. Okay, so we'll move on to Ms. Meredith. Since you are into the device industry since 2003, you joined EpiMed in 2003, I suppose. So it's been almost 2 decades that you are with the device industry. So I'm sure the device industry people, they are the best researchers in terms of the market, because they had to invest a lot into the research and R&D, and before investing into some device, they had to do a lot of surveys and the research, and then only they can go for some device into the market, right? So, from the survey point of view, so how do you see this pain management as a market all over the world?
Pain management as a market, I can't speak to other countries, but within the US, we've struggled a little bit. We've had development of new interventional pain products across the board. You know, we've got the new spinal cord stems coming out, and there's new needles, there's new radio frequency products. But I still feel like the US is a little bit behind the curve because we are still overprescribing opioids here. That's a constant thing. And I think no matter how many new and fabulous products get developed for interventional pain, our struggle here is with private health insurance. So no matter how many great products we have, we still struggle. And I know you mentioned earlier the term business, and unfortunately here it truly is a business. a lot of our pain community struggles with being able to offer the best and the most safest products to their patients because of challenges within the reimbursements of those. I don't think there's a problem with the development of technology because that hasn't stopped. I mean, we do have some phenomenal interventional pain products available to our community and to worldwide, quite frankly. It's just for us in the US, it's much more of a challenge offering that. And I'm sure as a pain physician yourself, you understand the dynamic that you want to use the best and the safest products. But if you know you're not going to be paid for those, it becomes that big question, not just for you, but for your patient.
Yeah. So you, Meredith, you mentioned about the insurance coverage in these devices. So a lot of time we see that whenever device comes into the market, obviously it comes after a lot of research and development. A lot of research has been done on this. It comes into the market and we see that it is a FDA approved device. But we also hear that even if it is a FDA approved device, the insurance company, they are not willing to reimburse for those devices. So why this discrepancy is there? Because FDA is approving and insurance company are not approving that. So why this discrepancy is there?
I feel like I've been fighting insurance, if you will, for now in my career, almost 30 years. And it's my experience that, you know, obviously these products must be FDA cleared. I think the misunderstanding oftentimes is with our health insurance companies, they feel like if a product is not FDA cleared, it's not legitimate. That's to say you might have a product that has a 510K, and we understand what that means with a 510K authorization. But from health insurance, oftentimes they think if it doesn't have a full FDA approval, if you will, then it's not legitimate. In the same side of that, you have health insurance here in America, you have to have a CPT code, which is a current procedural terminology. Just because you have a CPT code, which you must have to bill, doesn't mean any health insurance company has to pay for it. So I believe that it's the uneducation of our health insurance system that leads us to chronic reimbursement challenges. I think there are procedures that health insurance companies like, and then there are those that don't. And I think interventional pain, unfortunately, has been that subspecialty that's kind of for a long time has gotten not the best reputation. I can't speak to internationally, but in the US, if you were to ask 10 patients what interventional pain management does, they would tell you that's where you go to get your pain pills, not where you go to truly get treated. You mentioned earlier too about family practice physicians, and that's a challenge here in the US that physicians such as internal medicine and family practice, they don't want those patients to leave their practice. So they have begun to do epidural steroid injections and, you know, a myriad of different pain procedures with not the best outcomes. And what that means to health insurance here in the States, if they're having poor outcomes, that's just another justification for our health insurance system to not pay.
Yeah, so Meredith, you mentioned about the opioid crisis, which recently has come out in the USA. And the major reason behind that opioid crisis is that obviously that misuse of the excessive opioids. But at the same time, if you see that it is the insurance companies, is they are not approving some of the interventional procedures where we can do interventional procedures early and we can save these patients going into chronic pain. So that is also clinical side. We have a literature or we have a good supporting data that if you do it, interventions in the early stages of the pain, we can prevent these patients to go into chronic pain. And obviously, if the patients goes into chronic pain, then it's become difficult for them to manage also. And this is how they land up into opioids because we have to give them pain relief. So don't you think that if you go for the early, or maybe we can ask this question to some of the clinician, Dr. Sudhir Datta, you are there, sir? Dr. Sudhir?
Yes.
Sir, so we are discussing about the opioid crisis which US is facing, and we also understand that it is because of the non-application of the early interventions that is one of the reason for going into the opioid crisis. So can we think of that early, if we go for the early interventions, we can save people going into the patients going into the chronic pain, and we can save them from going into the
So thanks for the nice introduction and thanks for the nice discussion by Meredith. I think she has brought about several important and key points. I think she's given us a perspective from the industry, but as independent physicians, one of the key things that we have striven to do is to highlight our specialty, and a better educated patient leads to better educated outcomes. One of the things that we have used as a tool is to actually educate the patients about the procedures. And one of the things that she was mentioning about the fight with the insurance companies, the best fighter against the insurance company is the patient himself, because he's the direct customer for the insurance company. So one of the biggest mechanisms I have used to get patients reimbursed for the procedures is actually having the patients talk directly to the insurance companies. So I think in terms of the challenges, of course, getting the interventions authorized is a challenge, but I think the way you kind of evolve as a specialty is to learn how to deal with the insurance companies and with your customers, which are the patients plus any other people that you think. So one of the biggest things I think is to raise the awareness and also the profile of interventional pain management. And the way you do raise the awareness and the profile is to run various educational programs such as you're doing with the Zoom meetings and everything else. And then also highlight key achievements that you're doing. One of the key things that I do for my own practice is always try to be at the high, at the cutting edge. And once you separate yourself from the rest of the field, you do get an advantage in terms of having patients come to you. So I think in short, what I'm trying to get at is raising the awareness and raising the profile of interventional pain practice is both an individual responsibility as well as a responsibility of the specialty. So, if you can highlight the individual as well as the specialty, everyone grows up.
Yeah. So, Dr. Datta, let me continue with you. Since you have been following the Indian market also very closely, we have been in touch. We are always a part of the scientific sessions in India. So how do you see that? What is the difference in the Indian market as compared to the US market? I know the US market is quite advanced in the interventional pain management. Most of the procedures are there covered under insurance, which is not the scenario in India. But in terms of the pain education and the pain practice, what you have witnessed in the last 1 decade. So how do you see India is growing, whether in the right direction or so we need to do something else?
I think everybody recognizes that India is the newest, biggest, and best frontier in everything in the world right now, because of several advantages that India has. For example, it's the biggest functioning democracy in the world. It also has the biggest number of people, So as a marketplace, India is a huge untapped potential. In terms of where I see, one of the hamperings in India was the educational part, because pain was not accepted as a specialty initially. And I think the challenge was, how did people get trained? So some of the key thinkers like you went outside and got trained in outside countries, and then brought that expertise back to India and started the programs in India, which was a great achievement in a sense. You and others like you have developed the field greatly in India, to a point where now you're having the DNB done in AIMS, which is the biggest place. So that shows that you have very capable people in India, and it is now coming to the forefront. Now, we were always at an advantage in the US, because our first pain programs developed, I don't know, I'm just giving you a brief history of how things evolved. So we had our first pain management programs, which were certified, as fellowship programs, developed in 1994. So really, the birth of the pain management fellowships was in 1994. So it's one of the youngest specialties, which is the ABMS, which is the American Board of Medical Specialties, which is organized there. I see the same thing happening in India. India took off, and its growth is actually, now almost at par with the US. So there's a huge potential for growth. The other key difference that I have seen between the Indian market and the US market is the role of the insurance companies. In India, as I understand it, most of the procedures have to be done in a hospital-based setting, which has its own challenges. Even us as a specialty struggle to actually incorporate our practice with the hospital practice, because the focus of the practices are completely different. Pain management is meant to be ambulatory surgery, or a same day or a one-day procedure, whereas the hospitals are not. Their revenue is generated by services generated within the hospital. So I see that as a challenge in the sense that, for the cost to come down, it has to be done in an outpatient facility, not in a hospital. So that's one of the challenges. Most of the pain programs in India that I know of are somehow affiliated to the hospitals, and the hospitals also serve as a mechanism for drawing patients. I think it will evolve where India also moves to where it is more outpatient based versus hospital based. But I think that's one of the key challenges in India.
Thank you, sir. So now, since we are talking about some insurance and the costing of the daycare versus the admission, let me mention Mr. Manivanan here, because he has done a lot of extensive work in the pain management related to the costing and the pricing of the products. So, Mr. Manivanan, can you highlight to some of the key features in last 6 months, whatever you have done the research, how these pain procedures are beneficial to the community in terms, not on terms of the clinical side, we will talk later. We have been talking since last 2-3 days, but in terms of the finances to the patient also, and for the insurance companies also. Can you highlight some of your key research points?
Sure. Thank you for this opportunity, Dr. Pankaj. It's been some exciting time studying more than about 12 to 15 centers, and drawing out a standardization of about 140 procedures with the help of all the clinicians. The major issue in pricing and costing is that, as Dr. Sukhdev Datta rightly pointed out, today pain management procedures are being done as as part of inpatient admissions. There is a cost difference between inpatient admission and daycare procedure. Even within a hospital setting, when you do a daycare procedure, cost wise, it is much lower than a patient getting admitted. In fact, there are other specialties which are also converting many of their procedure with the advancement of technology into daycare, precisely for this reason, because there is a better utilization of the existing infrastructure. So when we did a complete study of the pricing and packaging, we found that there has to be a lot of standardization of pricing with the different components inside the pricing, which we have attempted to, which is going to really help the patients in approaching the hospitals or the daycare centers. And interestingly, the Indian model, business model, is of 4 types. One is there are exclusive pain management hospitals, which is about 10 to 12% in the market. The other one is about the pain management department of hospitals, which are because of the today's insurance condition, are carrying out a lot of procedures as inpatient admissions. Then you have now the concept of daycare centers. The daycare centers are really doing a good job now. As Dr. Datta pointed out, most of the procedures can be done in the daycare setting, whereby it can bring down the necessity of getting a patient admitted for the sake of insurance. So we have worked out the complete pricing and the costing pattern. We find that there is 2 to 2.5 times a difference between the procedures which are done in a hospital setting and which are done in the daycare. So there are about 30-40% of the pain management businesses which are now being run as daycare. Then you have, of course, outsourcing of pain management department. So overall, I find that there is a tendency to proceed towards getting the pain management procedures as daycare procedures approved by the insurance companies, so that the insurance companies also will have lesser incidence of claim ratio. In fact, when I was studying the publication in the US on health policy, the equalization of site of service differences, where the same service in terms of clinical outcome, in terms of techniques used, the service is the same whether it is done in the hospital or ambulatory surgery care center, or some of the procedures done in the physician office. When the three are being done, the advanced Medicare payments are still having differentials in US, which they are now working out and trying to bring it down. That is the latest report in 2018. I think a similar attempt should be made here also. We are now highlighting the authorities wherein the cost and price have a difference in terms of increasing the affordability. So which means when you are making it more affordable to large number of patients who are insured, then pain management has got a good avenue for growth, and it also gives you the sense of comfort to the patient, being a minimally invasive procedure. Given a choice in terms of costing, pricing, as well as a choice to the patient, people would still prefer a MIP, minimally invasive procedure, than a full-blown surgery.
Thank you, sir. Thank you so much for enlightening us with all the research what you have done in the field of pain medicine. And you rightly said that if we can do all these procedures, most of the procedures we can do in a daycare setting, we can also have a higher turn out ratio. Also, that also brings the affordability to the patient also, and also for the centers also. If you have a high turnout rate, in that case, you can do many procedures in a single day with limited resources. So that is another advantage for the healthcare industry. So with this, I would like to bring in patient Mr. Dr. Prakash over here. So Dr. Prakash, so as you know that the market forces is one of the biggest factor in the economics of the healthcare. Okay, and one of the market forces is the insurance coverage. If the procedures are covered under insurance, it basically pushed the specialty to a very fast level and a very high level. So you must have seen evolving specialties coming with especially with the minimally invasive techniques. You must have seen in other specialties also. And similarly, now you are seeing this pain management is coming as a big way. So how do you see this evolving specialty in terms of insurance coverage?
Yeah, Dr. Pankaj.
Yes, sir.
Thank you so much for inviting me, and it's like it's more of a learning opportunity for me, because I'm a general surgeon, and today now I'm in insurance sector for more than a decade, and very interesting to know about the evolution in the pain medicine area. When somebody told that it's more than 25 years since fellowship in pain medicine has started, and only now in India we are talking about insurance coverage. So in a way, we are lagging behind. And I've been thinking that, Manivanan used to call me, we used to have a dialogue on, inclusion of newer advancements in medicine. Whenever he calls me, he says, doctor, these areas have to be covered in health insurance for the betterment of the customer, the patient, and for the insurance companies, because, it's going to save them cost in the long run. And when I heard Meredith saying that, she's almost fighting with the insurers, I don't think in India the situation should come that we should fight it out. We should discuss, and very clear that insurance companies should come forward and cover management of pain medicine, because if you are going to help me reduce the outgo, whatever I have to spend for a total knee replacement or a decompressive spine surgery or a spinal fixation, through your genicular nerve block or whatever intra-articular injections or whatever way you are trying to do your pain management, radio frequency interventions. I'm told about, pooled radio frequency, hyperthermic radio frequency, so many new advancements. We also get claims for prolotherapy. And sometimes, we are taken up for surprise whether it should be. And my doctors call me, and we have a team of specialists and a guideline session where the panel of specialists, they used to tell me, like, there are a lot of requests coming in for pain management. So I want to clarify certain things here. Yes, of course, in India, with most of the health insurance companies, take care is covered. Initially, it was the days when insurance pays only for reimbursement, but now we pay for daycare services. There is no need of 24 hours hospitalization. And more than the treatment, she was talking about CPT, current procedure terminology. I do not, insurers in India, we are not keen to know about what type of treatment you are giving. We are keen to know about the diagnosis. If the diagnosis is covered by the policyholder. So somebody was I think Dr. Sukhdev was telling that, we should allow the patients to talk. There is no need. Actually, we don't want the health insurance policy holders to come and call us or ask us for any request, because it is their right. A person who has got a health insurance policy from a health insurer, and health insurance is a highly regulated industry in India by the Insurance Regulatory Development Authority of India. So a person who has a health insurance policy, supposing he has a degenerative joint disease, out of which he is suffering severe pain, which requires an intervention, only the diagnosis is enough for the insurers to approve. Whether this diagnosis has to be managed with interventional pain treatment or surgery, it is up to the experts to decide. We from a health insurance company, I cannot make my doctors to take a call on that. We are not seeing the patient. So naturally, if the condition is covered by health insurance, we will have to pay for the procedure, whether it is done as an intervention or as a surgery. Now, finally, before concluding, I want to say only one thing. The problem, I think the challenges faced on reimbursement, Mr. Meredith was talking about the challenges with the insurance companies, why she has to fight out with the insurance companies. I agree all that. Insurance companies should have the basic knowledge and information. He very beautifully said that information therapy to patients are very important. Dr. Sukhdev very beautifully, he said, a better educated patient has better income. So it is a duty of the health insurance companies to give that information therapy to the policyholders. Particularly a company like us, we are number one, Star Health Insurance. We are number one in India with for 15 years in the market. And we have a lot of policyholders who are more than 10, 12 years old. Naturally, we have the responsibility of caring for their healthcare. So it is our duty to keep them well. So we have to promote wellness in them. We have to take care of their pain before they go into opioid dependency, as Dr. Pankaj was talking about. So for all these things, insurance companies, if not today, tomorrow, 100% in India, they have to come forward and cover pain management as an outpatient treatment. Absolutely, there is no second doubt in that. But having said that, I want to put forth to Meredith and others, our challenges when it comes to covering pain management. What can be the challenges? Because we have a 25 to 26% of the market share in retail insurance in India. So we are not the 100% market shareholders, and there are 33 plus health insurance companies in India. So I can definitely talk to the General Insurance Council or to the regulator and take forth the views, because it's a great opportunity that I am able to hear you in this conference and understand about the advancements that are happening in this field. But my only request is, can this association help the insurance companies with what are the requirements for a well accredited pain management center, because we do not want any Tom, Dick and Harry tomorrow to claim just because insurance is paying. And any compromise to the safety of our policyholders, we are held responsible. We are held responsible for the morbidity and physical trauma, and also for the financial hardship he is going to face in the years to come. Because a customer today is going to be a lifelong customer for the insurer. Every year, it is his right. It is his right. Somebody has got a health insurance policy, and after getting the policy, he suffers a disease. It is his right to get renewed year on year. So naturally, the continuing financial burden is what the insurers are also worried about. So you organized a very beautiful conference. I think it should be the first step forward to create an association where you can come with a recommendation on what are the accreditation, infrastructure, expertise. Expertise, by the way, I mean that in India, do all pain management physicians have the same level of training? Are there people, I said, I heard that, after anesthesia, they do it as a super specialization. Are there people always take that super specialization route to do the pain management? Or they do some 1 or 2 weeks fellowship course or whatever, distant management, distant education courses, and then claim themselves to be pain management doctors? So what are the specifications for a very safe and license, and what are the requirements for licensing and empanelment of a pain management center? This is very, very important for us. Once these requirements are laid down, we can adapt this all over the country. We can go forward and say that, well, my dear customers, you need not go to a hospital, because Mr. Manivannan was beautifully talking about equalization of site of service. And today in India, from evidence-based medicine, we are going into value-based medicine. What do you mean by value-based medicine? For the same cost, or for a cost which is 1/20th of what is being charged in the Western world, we have centers and experts to give the same treatment with almost the same outcome for 20% of the cost. This is I'm talking about whether it is a major heart ailment or a major surgery, oncological surgery. In India, there are centers of excellence which can offer treatment for almost 20 to 25% of what we can spend in the Western world with the same outcome. This is what I call as value-based medicine. These are the strength that we have in our country. But the weakness is, do all of us have the same expertise, same infrastructure, and are our patients safe in the hands of all the pain clinics? This is the biggest worry. As a clinician and as a person in the health insurance sector, please ascertain us that our customers or policyholders are safe. If a center with the following setup and the licensing formalities are empaneled in health insurance, then naturally it is, as a medical person in the insurance sector, it is my duty to take it to the ears of the policymakers and implement it not only in our company. My company, like a Star Health Insurance, tomorrow I can implement. I can tell my doctors, okay, pain management is going to be covered. These are the procedures. Please go ahead and cover it. But if the whole industry has to adapt, I think we'll have to align. Star Health Insurance is willing to align with your pain management academy or foundation or whatever you have. We are willing to align with you. Let us sit, discuss, and lay down the requirements for empanelment of these centers, and then we can go ahead and we can promote this concept. As Dr. Sukhdev said, there are 300,000 plus advisors who are working for us who are selling the insurance product. If I'm going to introduce pain management in one insurance product, the trainers and the trainers, all those category of people are going to talk about pain management to the 300,000 plus people who are going to sell the insurance product. So several 100,000 people will come to know about these type of advancements and facilities that are available in India. Help us to do that. We are willing to align with you and go ahead. Thank you, Pankaj.
Thank you so much, sir. I'm sure that our listeners who are there, their youngsters are there, they are very, must be bubbling inside listening to your encouraging words. And definitely, sir, we take your words, sir. We'll definitely work on it. We've been working on it, as I mentioned, that as a society also, we have taken a lot of steps in accrediting the pain physicians and also what the centers also. So we have been doing all these homework from our side, and we'll definitely discuss with you, and we'll assure you that the pain physicians who are treating the patients or the community who are serving the community, they will be well trained and very ethical practice. Thank you so much, sir. So with that, I'll move on to Dr. Sudhir Diwan, sir. Sir, like we have been seeing a lot of advancements also now in the field of pain management in terms of newer technologies which are coming. Like we are talking a lot about regenerative medicine is one of the most important. If you see from the market side, the radio frequency, the regenerative medicine, and the stimulators. These are the three areas, and the fourth is the endoscopic. Endoscopic. So these are the four areas where the market is very excited about that they will have the big growth in the future in next 5 years. So where do you see that these advances, adoption of these advanced procedures will take this pain medicine to?
Dr. Pankaj, first of all, thank you for inviting me on this wonderful panel. I'm very impressed because you have brought together some experts, not just locally, but nationally, internationally renowned. So I'm very fortunate and to be part of this. For example, from here, Sukhdev and Meredith and Maya, they are experts, you know, in the field that we are very fortunate to work with them. For example, Meredith is one of the best in the country, maybe in the world, about coding and how to increase your revenues. So in terms of these advances, this is actually comes down to the real business. When I say real business, is not really making money, but being successful into not just paying our bills, but without compromising the care of the patients. And that's what our goal is. And at the end of the day, our goal is to really provide the best care to our patients. Having that in mind, all these technologies has really changed the landscape. What we are doing right now, we didn't know 20 years ago whether we could ever do that. But that's the process. That's the process we have to go through. For example, when the cardiac cath came out, the cardiac surgeons were very hesitant to accept it that it's going to work or not, and there was a big kind of opposition, and that is well understood because there is always a tendency to protect your turf, and if somebody tries to step on, you protect it. I think we are going through very similar situation right now. The technology is so much. For example, I'm very much involved into minimally invasive sacroiliac fusion. Now, to have a sacroiliac fusion done by a pain specialist is kind of not very well accepted. But we are doing this. I'm doing in my surgery center. Patient comes in for IV anesthesia, no intubation, and some sedation, and patient goes home within half an hour. So the the technology has advanced so much that has put us into situation that there is so many things we can do with minimum trauma to the patient, and the outcome is not compromised. So it is changing. It is changing in terms of treatment options that we have for spinal stenosis. We do here call spacers. Spacers are indirect decompression of spinal stenosis that you can do within half an hour. Patient goes home walking. You don't have very long rehab period. The walker to cane to start walking. Patient walks out of the recovery room. Or there is another procedure called mild, which is minimally invasive lumbar decompression, another very important minimally invasive procedure. So now that we are in one of the best time in our practice as interventional pain management, and the reason when the reason why I say is, if you look back to when Dr. Raj and Dr. Rak, Prithviraj and Gabor Raks were trying to expand the education of pain management across the, beyond America, they did not have the technologies that we have right now. Right now, we have ability to collaborate with everybody, with marketing with Maya, and revenues with Meredith, and experts like from other fields that can help us. With that in mind, we are actually moving pretty well. We are not anymore injection experts. We are actually interventional spine experts. So people don't call you and say, okay, Dr. Dewana, this patient needs epidural. No, we see the patient, we do the assessment, and we decide the best care for the patient. And now, I think fortunately, we are accepted as a part of the team. We still have a long way to go. There is still, a sense of protecting the turf. There is still, people think that no, pain management should not be doing these procedures. I was a chairman of the pain program at Cornell for a very long time. And I used to work with a spine surgeon who would do a kyphoplasty in the operating room. And as you know, kyphoplasty is a pretty tricky procedure. You intubate the patient. It takes 45 minutes to position the patient because you don't want to destabilize the spine. And I had a dinner with this gentleman 2-3 months ago, and I said, Joseph, you know that I do kyphoplasty in my office? He said, no, you cannot do in your office. I said, yes, I do in my office. IV sedation, skin to skin, patient is off the table within half an hour, and he could not believe it. The point is that we really have mastered the skill. We have taken the advantage of the technology, but I think we still have a long way to go. There is a lot of gap between the education, a gap between what we do and what patient knows about what we do, a gap what we can do, and our colleagues, spine surgeons, are ready to accept whether this is alternative or not. So there are a lot of gaps. There are a lot of challenges that we have. But by far, I think we are doing very well. The regenerative medicine is going to be very important down the road. And the reason is, and I very strongly believe that there are two conditions, and mainly one condition, which is a degenerative process, which is degeneration of the arthritis or degeneration of the spine. These two conditions are the major source of your major surgeries. Joint replacement and all these extensive, spine surgeries. So if we can prevent the degeneration from progressing, and if we can provide a regeneration, then you can see that there is no need for all these major surgeries for joints and spine. And the only treatment option that can offer this is a regenerative medicine. So I think, there is a lot of things we still have to learn. We are trying to figure out the hostile microenvironment that the degeneration causes, and how to reverse that hostile environment. There is a future which is a nanotechnology and bioprinting that can help us to master our skills, and we are progressing fast. We are really progressing fast, and I'm very hopeful that within next decade or so, we should be able to at least prevent the degeneration progressing, so you don't really need to rush for big surgeries.
Yeah, thank you, sir. Maya, let me go back to Maya. Dr. Sujit mentioned about there's a big gap between what we have to offer as a physician to offer, and what the patients know about what is there in the market available for them. So there's a big gap, and I think to reduce this gap, I think the marketing has a very big role here. Since you are also running some marketing agency, Andrea's marketing agency, right?
Yes.
So can you throw some light on the marketing part? How ethical it is for the physicians to go for the marketing? Because a lot of time what happens that we see that people are over promising the interventions, that they can do this much, they can do that, they can give 100% relief, like this sort of stuff. So which is actually not ethical. So do you have some tips for the physicians where we can do some ethical marketing? to do
Yeah,
this?
I think practices can really benefit from doing internal marketing, doing waiting room marketing, doing social media marketing. But what they need to do is really project to their patients what the step-by-step is of each procedure and what they can expect as an outcome. So, so as not to frighten or not to blindside the patient when they come into their office. So any type of marketing materials, whether it's short testimonial type videos that you can do, but social media today is one of the best ways to reach your market. And you can reach it very geographically through Facebook marketing, through Instagram marketing, just in your hometown, just near your practice, and just to patients who are in pain. So there's a lot of ways to do the research that you can fine tune the audience. But I would also say just doing in waiting room marketing and making sure there's an education portal there and a way for your patients to understand better what your practice offers on a regular basis.
Yeah.
And if I could interject real quickly, from an industry standpoint, I can't speak for every company, but I can tell you EpiMed as a whole, for procedures where we provide product, we have developed what we call patient education brochures, which have been written in layman's terms, if you will. So I would encourage physicians to ask the companies and the reps wherever they're purchasing their products, if they have some type of marketing piece that they can provide to their patients so that they don't have to create something else. But we try to be very good in that respect, from being able to leave brochures in the waiting room or in the patient exam rooms. So if a doctor is going to suggest a specific procedure, he can say, well, here's how you can read about it.
And also, Dr. Pankaj, the marketing concept is different here in the Western world. When we say marketing, we are actually not marketing ourselves like we are the best in the world and I know everything and I will change your life. We actually market by providing the education, that what we do and why we do. And in that, we have a very successful partnership with the industries. For example, and again, as Meredith says, I'm not trying to promote any one country or company over other, but most of the industries, they have education branch. When I was a fellowship director, I was getting grant from Medtronic for fellowship education, and that will come with a folder that is for fellows, what they are supposed to learn, what they should learn, and what are their opportunities. So of course they have their vested interest to promote their own industry, but with the goal and with the intention to provide the education. So I think that is also changed lately, that yes, you can market, but market to provide the education, not that there is another that okay, I'm only interested in making money. Even if that concept is behind, you have to really do more effectively and more positively.
Very true, very true. So, so like Meredith has mentioned that they have some videos available which you can use in your office, or you can put it in your website also. But before that, what you mentioned is that very important, that this whether the physician who is putting that that information on the website or on his office, in his office, whether that physician is trained for that technique or not, that is also very important. That I think the company, the industry people, they need to support the physician for that, for the training part.
That Dr. Pankaj is extremely important, and I'll tell you, especially in a field of regenerative medicine. I'm giving the courses, and I work with some internationally renowned experts in the field of regenerative medicine. And if you go into some doctors' websites, there is so much of unnecessary hype marketing is done on that website that finally they end up being investigated by FDA. So there is a lot of bad players out there. So you are absolutely right. What we really need to do is based on the evidence, because we are practicing evidence-based medicine. If you don't have evidence, And if you don't have results, don't talk about it. It's, not just making it, very interesting word or stem cell and to make and build, your practice. That should not be the goal. I remember when I did my surgery in Ahmedabad and I was getting my diploma, my professor of surgery told me that Sudhir, never try to earn money as a doctor. Just do your job and do your job the best, and your money will follow because it's a byproduct of your services. And I think that's what we need to do. If we really do our job as the best doctor, everything else, your money, your reputation, everything will fall into place.
Thank you, sir. Thank you. So let me pitch in Mr. Deepak Pandey here. So Deepak, as you have some products, the implants, which are very advanced implants, like we also introduced in our AMP conference, the spine spacers and interspinal spacers, and also the fixation of the SI joint. So you're coming with a very good innovative ideas and also minimally invasive techniques, and you are also targeting the market of the interventional pain management and the pain physicians. Definitely, we are discussing about the insurance part also, and the costing, as Mr. Vani mentioned about the costing part and the pricing part of that minimally invasive techniques. So how the industry, because what happens that whenever this new device comes into the market, they are so costly that actually it goes beyond the surgical cost also. So this is what has happened in India, because it's very difficult for the people to afford. So they always compare with that. This surgery will cost me this much, and you are talking that minimally invasive, and you are telling me that it is going beyond the surgical cost. So what industry, the device people, what they can do to bring this cost down? Can they do something for the developing countries? They can bring this cost, they can provide these devices, because market is huge. Market is huge. Affordability is an issue. So can device industry can do something about it?
Thank you, Dr. Surange, and everyone in the panel. Appreciate everyone's input. A lot of panelists have touched on very important points in this session here, and especially when you talk about the costing of devices. US market is definitely different, where you can invent a device, it is cutting edge, you can charge enough. However, when you're planning to go in countries like India or any developing countries in Indian subcontinent, be it Bangladesh, be in Pakistan, be in Sri Lanka, the affordability is definitely going to be an issue. And the way what we have thought about, because we are working on an initiative, we call it a Sabhi initiative, and we are trying to position how we can support not only the pain physician, because some of the devices that Dr. Diwan also mentioned, or procedure that he mentioned about SIJ fusion and decompression of lumbar spine, those procedures can be performed by pain physicians. And of course, it's taking, there is a wave that's going on here, at least in the US. A lot of good pain physicians are getting trained and starting these procedures. The way we thought how we can reduce the overall cost and provide value-based medicine that Dr. Prakash was also talking about, having the economy of scale in the market like India, we have to think about the product innovation. So when I say about the product innovation, that means if you look at certain products today, and if you look at their footprint, the number of implants that they will carry in the set, the number of instruments that they will carry to perform particular surgery, they're huge. So the overall set cost itself become too much. Overall procedure cost, when although you're charging only for the device, which is the implant, but there is associated cost, which is how many instruments you are carrying in the set. So that's one thing, product innovation, to find out how you can minimize the number of instrumentation, number of components in that procedure. The second is technique innovation. like Dr. Diwan mentioned, Dr. Datta mentioned, when you talk about the technique should be so that you can perform these procedures very quickly. And when I say quickly, that doesn't mean in any subpar manner. Delivering the same outcome as any existing bigger system will deliver. So for that, you have to work on our supply chain design. When we talk about our supply chain design, we have to think about what and where we should manufacture, what kind of strategy we are going for. For example, there are a lot of ways you can design your supply chain. You can put postponement strategies. You can deliver. You can utilize economy of scale. You can manufacture close to the source. So we have to look into all those things as well. When we look at, and I can give you one example of the product that we carry. It's a SIJ treatment product. We have brought down the overall system. The number of instrument in the set is close to 6. It's a very fairly simple technique. Now, when you talk about a country like India, we cannot enter in that country with a massive instrument set. Its affordability is one issue. Also, how you process those products in the surgery, in hospital or in surgery center, because those resources are not there. Another thing I wanted to touch base very quickly on, can you do the procedures in a setting where the overall cost is not high? So, for example, if you are targeting the hospital systems, the overall cost will be
here?
high. I'm sorry?
Can I stop you here for a minute?
Yeah. Yes.
Okay. So like you mentioned about the bringing the cost down. So is it possible that if you have an implant, which is definitely your research product, you can manufacture it in US, but the supporting equipments which are there, we can outsource to the countries. Like suppose if in India, if you want to outsource this to some company in India, and they can manufacture the supporting equipments, and you can bring that implant. So that with this, we can bring the cost of the overall set. We can reduce that cost at a very low level. Is it
absolutely
possible?
Absolutely? And we have identified, if you look at the city like New Delhi, there's some good companies who are producing very good products. So collaboration, like when I said collaboration with international players, you can do the strategy where you produce the product that require more control in the countries where you are approved, and you can do certain things, for example, instrumentation and all in the countries where you are targeting to, where you're selling the product to. So definitely that's one of the strategy. Yes.
So Mr. Manivan, he would like to mention something here.
Probably when we are looking at technology, I just want to highlight this for the attention of the device manufacturers. Only in healthcare industry, I've been into costing for the last 2 decades. I find that only in healthcare industry, the advancement technology always, at least in the initial 5 years of adoption of technology on a large scale, increases the per unit cost of the treatment. So which is a major challenge. So somewhere the byline which I am now propagating is, it is not necessarily advanced technology, but it is appropriate technology. For example, with the use of a technology, if a patient has to stay in the hospital for 3-4 hours more, I don't mind doing that if it is going to be cheaper, rather than asking the patient to walk out in about an hour's time. But the clinical outcome being the same. So this is one challenge which I wanted to bring it to your attention. The second is the challenge which the countries outside of euro currency or dollar currency countries would be the currency power parity. The cost of the currency is naturally quite different when you compare with the Indian or other Asian currencies. That itself translates into a higher cost when the equipment are all imported. So that is why there is always an insistence from many of the countries that can you shift the production where the cost of currency could play a role. After all, the cost of currency, the purchasing power parity also decides the affordability in many of the cases. So these are some of the challenges which I thought that I would share here. So the major challenge will be when I did the costing for about 125 procedures or 140 to be precise. Most of the procedures in the daycare setting is definitely less expensive. Even for multi-speciality hospital, a daycare procedure is less expensive compared to an admitted patient procedure. So there also it is going to be bringing down the cost. But the challenge which I found was in cost of implants, in cost of various disposable, like other your balloons or various other chemicals. I'm not having it in my memory straight away like you, but I could give you a lot of instances. I have a list in the report which I've submitted to the committee. So these are the costs which would pose a challenge in getting the insurance approval. I feel that is one challenge which all of us have to overcome when we approach the insurance companies.
And also we talked about the supply chain, that we can go ahead with the bulk purchase of the consumables or the disposable. That also can bring down the overall cost for the procedure.
Yeah. In India, we are slowly moving to group purchase concept, which is very popular in US and other countries. There are corporates which are devoted to group purchase system, but I feel in pain management there is a very good live association which is taking the responsibility for growth of the branch here. So they can also kind of talk to the suppliers or the vendors and form a chain. So for various insurance programs, the insurance program can specify through a not-for-profit organization where the supply chain can be operated and the procurement can be made. So the affordability can be much more, and we can increase the volume, of course, with more awareness.
So very quickly to just tag on Mr. Manivannan, you're absolutely right. Device companies, if they can get assurance, or if they can achieve the economy of scale that we are talking about, they can tackle any kind of cost pricing, cost structure. That's not an issue. The challenge happens, the high cost of implants and device cost is because of the inefficiencies that come from the system. Like you mentioned about the GPOs. I know that in hospital in the US, this concept is quite prevalent, but I'm not sure if it is in ASCs, if that's the case. Maybe if there could be some sort of collaboration between multiple ASCs, and we can get into some sort of economy of scale where more ASCs can do the purchasing of similar implant, and the companies can achieve that economy of scale. The pricing is not an issue. I mean, the costing of implants and hardware is not an issue. So that definitely companies can figure out.
Also, Dr. Pankaj, I'll add one more thing, is to have a local governmental support in terms of bringing the prices down, because how you manufacture, how you distribute, where your raw material comes from, your manpower, and because prices goes up because of adding all those things. And if you have a governmental support, it really can help you to bring the price down also. And representing to our health ministry what we do and why we do and why we need that support may also help tremendously to bring the price down.
Absolutely.
So, Dr. Sukhdev, since we are moving towards endoscopies, and we're talking about the spine fixations, percutaneous fixations, so do you think that competitive forces are becoming more active if we are venturing into more advanced procedures? Maybe they are thinking that these are the disruptive forces which are joining us, and that's why the competitive forces have become more active. Like we saw what happened a few years back, that some report came from the FDA that steroids cannot be used repeatedly. Those kind of things we may foresee in the future also with the advancement.
Well, I think being collaborative is actually a better idea than fighting for turf. And I think that is the only way that you can move forward. For example, if you kind of carve it out as being only orthopedic surgeons or only neurosurgeons can do this procedure versus having pain physicians being able to do it together too. The only way this evolves is if you make everyone part of the solution. So what I think is important is that we build up a care model, like they were mentioning, from the insurance and the value chain system. So ultimately, if you deliver value, then everything else becomes the norm. For example, if you think about it, who would want to get an open cholecystectomy with a large incision anymore? I mean, the norm has become that you do it with a laparoscope, and you have a laparoscope cholecystectomy. Same thing with the, heart procedures. Initially, when it started, it was only the, cardiothoracic surgeons were doing it. And now everything has evolved to where you can do even, transcatheter aortic valve replacements. And it's been done by the interventional, cardiologists. So I think as such, the value, ultimately the patient decides, the market forces decide, why do all these newer technologies evolve? Because the patient or the market needs it. And then who becomes the expert in it? I guess the people who adapt and evolve the technology the fastest and the best. So I think, moving forwards, I think it will be more and more where we are leading the technology and we become the field experts in it. At the same time, I think the technology evolves better if you collaborate. If there is not active, turf discussions all the time. I mean, I have tried to do that in my field. I work collaboratively with, orthopedic surgeons and neurosurgeons. And I believe ultimately the patient benefits from the collaboration. So I think we have to move away from like this, one piece of the pie model to like having everyone having a piece of the pie.
Yeah, that is true from the clinical side of view, but from the industry side, if you see the device industries, because we know that since these minimally invasive techniques are advancing and they are giving good outcomes also, and some markets, some implant markets, they are seeing downtrends. So do you think that maybe somebody from the device industry, they can Meredith, maybe you can answer this question. So how these competitive markets in terms of device industry, they see this minimally invasive spine interventions as their counterparts?
Well, I mean, we take a lot of lead from the physicians themselves in terms of product development. What is it going to take to make your job safer, faster, better, from that respect. So we do take a lot of direction from the physicians themselves. I can't speak for all industry, but, our organization is one where we are very driven by the luminary physicians in interventional pain, because we are just interventional pain products. So, we're that organization saying, you tell us what you need and let's collaborate on it together.
Yeah, if Dr. Surange, if I may add very quickly to Meredith's point, definitely is the key. And even in the companies like ours, we collaborate very closely with the physicians and surgeons. And that's the only way we can deliver that the product that can minimize the overall footprint. Because if you ask an engineer, just purely an engineer, to design a product, they over-design always. And what Mr. Manivanan and other panelists were saying, achieving that value-based medicine, it would be very difficult if that collaboration is not there.
Absolutely.
And absolutely, this one thing I would say that smaller companies, they do particularly better job. And there are many of these small companies that operates in niche. They do a much better job collaborating with physicians, with surgeons. Bigger companies, it becomes a little difficult. When we talk about companies like Medtronic, Stryker, of course, they have some of those systems, but it becomes a little difficult. In companies like smaller companies, engineer directly can collaborate with the physician, which physician love, and that's how the best product comes out.
Very true, Deepak. That is actually what is lacking in India, because we do not have any access to such companies, device companies. Even if we have some good ideas, we are no, we are not sure where, to whom we should discuss with our idea with. Suppose if we want, we have some device with us and we want some improvement in that device, we do not have any person or the company who can listen to us and who can modify the device according to our need. So that is, I think, which is there in USA, and they can collaborate with the physician, and that is why you have a good products which are coming up. Maybe in future also we'll also take it from our society side, that we can collaborate with some of the device companies, and where we can tell our ideas and they can innovate new products. And this is actually the good time for the pain physicians. So all the listeners who are there, because this is an evolving field, every day new products are coming. You saw in last 10 years that every day, every year we see a lot of new products are coming, and this is a good time to invent also. And you must invent, and something you must innovate and come out with some new products, and you can also patent them also. So this is the right time for the physicians also to get into the research and innovate new devices. So with that, I think we have come to our, we covered almost all the aspects of the pain medicine as a business of the pain medicine. And before leaving, I would like all the panelists to just say some few words to our listeners, some encouraging words, so that a lot of young pain physicians are there, because we have a market. Now we know that we have a big market. The only thing which is lacking in India, I'm talking about India right now, that we do not have a good pain physicians. We are lacking in the number of providers. So that is one thing where we are lacking. And maybe your encouraging words will help them to come to this pain medicine and take this pain medicine as their primary specialty. So maybe we can start with Maya.
Yes, I would just encourage all the pain physicians out there and the studying pain physicians to just continue education and to find those resources wherever you can. A site like Paincast basically allows all the different members to communicate with each other, to collaborate, procedural videos, from webinars, things like that. But anywhere you can continue to get the education and further your advancement of the field is key in establishing an excellent career.
Thank you, Maya. Thank you. Meredith, you are there?
Sure.
Yeah.
I just want to say that there is such an opportunity for success in interventional pain, and the need is always going to be there. And you know, as many of the physicians have said, focusing on just the welfare of your patients, and know you're getting into it for the right reason and just to help the patient. Everything else will work itself out, but there's so much room for success.
Thank you, Meredith. Thank you. Dr. Sudhir?
I very strongly believe the best marketing is education and research. And also to really have the meaningful, interactive, interdisciplinary dialogues. I think the best example of what you have just set up today, bringing the experts together, talk, and let's hear their view, let them hear our view. And final goal is again to provide the best care to our patients. So these interdisciplinary dialogues and ongoing dialogues are very, very important. And education to our patients, to our colleagues, to our referring physicians is also very important. And I think we are in the right direction.
Thank you so much, sir. Thank you. Mr. Manivanan?
Yeah, I think from my last 6 months of interaction throughout the country, I'm quite excited about the pain management as a specialty. The one great advantage I find is it's a scalable model. Let me talk from the angle of the business per se. Whether we like it or not, it is a business. We need investment. Investment needs return on investment, which will ensure quality and affordability both. ROI doesn't mean affordability is ruled out. So what I suggest is that always look for appropriate technology and not necessarily advanced technology. I'm not against advanced technology, but ensure that you are cost conscious. And two, uh, as a daycare business model, it is doable, very asset light, and it's scalable. So I think you're all in for some good time. So with the proper awareness of cost and standardization of pricing across various different models and locations, pain management should see a good growth. All the best.
Thank you so much, sir. Dr. Prakash?
Yeah, this is actually a boon to the patients who are suffering with pain. So, what role do I have in pain management? Rather, I should say that it is my duty to come forward and cover pain management. Why I say it is my duty? Because it is going to help millions of people. But what I look forward to is two things. One is an authorized pain management center. What are the requirements? We need to know and we need to draft it, which can be followed on a national basis. And the second thing is standardization of cost based on the type of procedures that are successfully done in the pain centers. I wish all your efforts a grand success. Thank you, Dr.
Thank you so much, sir. Thank you so much. We'll take care, sir. Dr. Deepak?
So thank you, everyone. Again, one thing that I want to add in this, as a device company, we are always looking to collaborate. We are looking, like Dr. Datta, Dr. Diwan, almost everyone mentioned in this talk, collaborate with your devices, get educated. So, and this is no burden to new physician, anyone who is starting. We train people. We train doctors who are coming out of college. We train doctors who are already established and want to get trained on their devices. And so is every other company. It's not just us. A lot of companies do that. Reach out to them, collaborate with them, and get trained. When you start doing procedures, the company will support those procedures. And as you do a couple of procedures, you will get the proficiency, and that's it. After that, it's just collaboration. In my mind, I think collaboration with the industry, close collaboration will take the field a long way. I mean, this for me is again, I'm also new to the pain field, probably 6 months, 7 months. Before this, I come from a full-fledged spine company, but these two products that I'm representing, we saw an opportunity that will fit right into pain field.
Thank you, Deepak.
Thank you.
Dr. Sudhir?
Yeah, so just in closing, I feel like I am very lucky to be in the pain management field at the present time. One of the things that you were highlighting was that how many people go to the general practitioners to get treatment for their pain condition, which is almost like 80% in India. In the US, we have managed to become the general practitioners for a lot of people with pain problems and also other problems. We have become de facto gatekeepers of the spine patients. And that is why, this pain practices are much larger than any orthopedic practice or spine practice. And in fact, we serve as the referrals for, referring a patient if needed for a spine procedure and orthopedic procedure. And I feel we have gotten to this point by really taking the field forward in terms of educating the public, educating the patients, and also the payers. The government knows that the interventional pain is a specialty. One of the key things was, one of the fields, one of the societies that Dr. Diwan was the president in, it was founded by Dr. Manchikanti, the American Society of Interventional Pain Physicians. They did a big role in educating the government. They went ahead and they did a lot of government lobbying to actually establish interventional pain management as its own specialty. And with that, once it was recognized by the government, it percolated down to the insurance companies and then down to the patients, because patients could seek care at the pain physician level because it was covered by the insurance. So I think everything starts at the top. So I think actually at this present moment, your society Dr. Surange can take a leading role, because you have to interact at the governmental level so that some policy changes can be made at the governmental level. And once those policy changes are made, it will trickle down below. It will trickle down to where the pain physicians in India will become the general practitioners and the gatekeepers to spine and orthopedic referrals. So I think that's the key point. I think the education and everything is good, but I think the pain physicians of India has also got to get involved in the policy-making decision, and at the governmental level, at the insurance level, trying to establish the credibility of the field. So I think it's very exciting. I think, you can take a page out of ASIP's book and become that sort of a key premier organization in the India to kind of help Indian pain physicians develop the credibility.
Thank you so much, sir. Thank you so much. So with this, we'll come to the end of this session and also the conference also. Would like to thank all the panelists. I'm sure that whosoever the delegates who are listening to us, they must have understood why it was important to discuss this aspect of the pain medicine. I'm sure that the thinking about a pain medicine or the specialty, it will definitely change after this conference, and people will start thinking in terms of the growth of this specialty. And with all your encouraging words, whatever in this last 2 hours, whatever we have this from the panelist side, so I'm sure that all these words are going to help them in developing and coming to the field of the pain medicine. So with that, I'll once again, I will thank all of you, all the panelists, all our delegates who has made this conference a big success. We had more than 450 delegates in this conference, 65 faculties from across the globe, and around 20 from, we had delegates from 28 countries. So this was one of the first virtual conference, and Corona has shown us this way also, innovation also. Maybe in future, the physical conferences may be replaced by these kind of virtual conferences. So this is one of the innovation also. So I would like to thank all of you, and I would like to thank our team, the team of IPSC India, who has worked since last 3 months, because suddenly I came with the idea that let's go virtual, and I just declared it, and they were like, oh, in just 2 months we have to do everything. So they had really worked very hard. I would like to thank Dr. Swati, Dr. Namrata, Dr. Rohit Lahori, Dr. Gaurav Goyal, Dr. Ashish Chakravarti, and Dr. Pavan, Dr. Prasad, Dr. Harshita, and my daughter also, Anushka. She was there with me throughout because her college is not so because of COVID it is closed. So she was here in Delhi with me. So, and she also helped me for the last three months. So thank you all. Thank you to all of you. See, maybe we'll come out with another conference next year. Let's hope for that. Thank you so much.
Thank you.
Thank you, everyone.
Thank you.
Very much.
Yeah, thank you very much. Yeah.